Hello, Dr. Furtado. I'm Dario Fernandez. I'm going to demonstrate to you the reflex testing of the brachioradialis. The brachioradialis inserts over the radiostyloid process. I'm going to tap a couple of inches above that. I'm going to have my patient relaxed as much as he can. I'm going to look for a normal response, which would be a grade of 2. A normal response would be a grade of 2. If there was no response, it would be a grade of 0. A diminished response would be a grade of 1. A normal is 2. 3 would be an exaggerated response, and a grade of 4 would be considered clonus, which would be a continuous, repetitive response to the stimulus. I will now test the spasticity to the extensors of the knee, the quadricep. What I'm going to do here is I'm going to first take her through the range of motion. I'm going to give her a little bit of time to rest, and then I'm going to apply a quick stretch to the quadricep, and I'm going to observe for any resistance to that stretch. So a normal response, which would be no resistance, would be a grade of 0. A grade of 1 would be considered minimal response towards the end range of that motion. A grade of 1+ would be considered resistance, minimal resistance, halfway through the range of motion. A grade of 2 would be moderate resistance with the ability to passively flex that knee. A grade of 3 would be moderate resistance with the inability to passively flex that knee. 4 would be rigid, and a grade of 9 would be the inability to test. I will now describe the anterior medial corticospinal tract pathway, which starts at the cortex of the brain. It will descend ipsilaterally through the internal capsule and through the anterior portion of the brainstem. It will continue to descend ipsilaterally to the cervical and thoracic spine, where it will synapse with a lower motor neuron. That lower motor neuron will then travel to the muscles of the shoulder, the cervical region, and the trunk, and they are responsible for postural adjustments. There is a fiber that crosses the spinal cord, and that is going to connect with the lateral corticospinal tract. Thank you, Dr. Furtado. We'll see you in a couple of days.